48 hours after inguinal hernia repair, left side. Listen, this is what I can tell you guys. My hernia wasn't that big. 3 small incisions. They took care of it, put a mesh down there. Contrary to a lot of YouTube videos, the pain is not that great in my case. There's different types of repair procedures for hernias. Sometimes they make large incisions. Sometimes they do laparoscopic. Sometimes they have to patch a bigger area. Your recovery is going to be different based on the procedure that they give you and the type of hernia you have, how big it is, all that kind of stuff. In my case, it was small. It's exactly 48 hours after the procedure. I don't feel much pain anymore. I was taking 600 milligrams of ibuprofen every 8 hours. That helped, but I stopped taking that about 10 hours ago. The pain is manageable. I've taken been able to take some stool softener. I started that right when I got home from the hospital, and I've been able to take about 3 dumps in the last 48 hours. 3 good soft shits, and didn't push when they came out. They just fell right out. And urination, when it comes to taking a piss, just relax, let it go. I'm not really doing much to aggravate or work my abdominals. And I have been outside walking for 10-15 minute spurts and trying to take a few hour rest between that, then get back out there and keep moving. And I think that's helped the recovery a lot. Like I said, it depends on the type of hernia you have, the procedure. But for my procedure, a small inguinal on the left, laparoscopic. You saw the incisions in the beginning of the video. Exactly 48 hours after surgery, I'm feeling pretty good. The only things that really hurt is if I have to cough, and I really want to cough big. Like I feel like I have some stuff in my lungs that I want to get out. And I think it's the anesthesia. When I went under, they had a mask on me and perhaps some stuff down my throat, some tubes or whatnot. But I feel some gunk, some kind of junk in my lungs. And I really want to cough really hard to get it out, to clear it out. But I can't do that. So I'm doing these tiny little coughs to try to work it out softly and without exerting too much force on my abdomen. And I have a asthma inhaler that I had from a cold that I had a few months ago. Still have some of it left. I took a hit of that, and it really helped work some of that junk loose. So when I would kind of do that, I would get some stuff coming up, and it helped relieve some of that feeling of junk that was congesting my chest and lungs. That's about it. That's all I got to tell you guys. Make sure that you eat leafy, fibrous meals before your surgery. Make sure that you continue a fibrous diet after your surgery for a number of days. You will cough was coming. You want your stool to be as soft as possible. Be sure you hydrate a lot. And if you have to cough, hold a pillow or something soft in your stomach, on your stomach for support. Ice it down. Use ibuprofen, whatever the doctor tells you to do. Follow that advice. It's good. And keep moving. You got to move. When you're tired, rest. Then try to move. Get it going. Get your blood going. It's going to help you recover a lot faster.